All right, hello, and thank you for taking the time to be part of South Central Health and Central Valley's Community Health Needs Assessment process. I am Sean Larson, the project coordinator with the Center for Rural Health, and Amy Bregenzer assisted me on this assessment. While we normally present this information in person, so we are able to interact and ask and answer questions, as you're aware, the pandemic is keeping us from being able to come out to the community. So, but we want to push through for our deadline coming up. So again, thank you for taking the time to be with us here for what would be meeting 2. Okay, as a group, well, actually individually, but we'll be together while we're apart. Today we are going to present you the findings from the key informant interviews that were conducted and the data from the online and paper survey and secondary data. After this, we will give you a link and ask you to complete a brief survey that'll allow us to gather your top concerns for the community. So nonprofit hospitals are required to conduct a community health needs assessment every 3 years in collaboration with public health. It is an opportunity for the health organizations in the area to kind of take stock of the community assets and challenges in a way that has community buy-in because they're providing direct input. And since this is done every 3 years, there's an opportunity to benchmark and track changes and progress throughout the years. I want you to take note, please, of the ndchna.org link down here, which will go over some of the things you'll be able to explore in just a moment. So consistency in data. The Center here for Rural Health, we conduct over 86% of North Dakota's critical access hospitals, CHNAs. So throughout this process, we utilize roughly the same assessment method. So we are able to aggregate our findings to present to policymakers to help improve the health of communities at the local and state level. While the process is generally the same, we do tailor the surveys and some of the questions for the community, but the methodology is pretty much the same. This also provides us a means to share findings amongst various communities so ideas can be shared. And that kind of comes into play in our next slide. So if you look at our top health needs across North Dakota communities, you can access this by going to that link that I mentioned earlier, that I showed earlier, ndchna.org, and this will be under the top health needs link on the left side of that page. And you'll come to this map, and it's an interactive map. Each of the little orange guys here, the group cluster of people, represents the critical access hospital working collaboratively with their public health. And the blues are those that are working independently, largely independent. And then the greens are, of course, the urban areas, the hospital in urban areas. And then you can see the public health logos all across their areas. Now, if you go to that website and you were to click on these, it would show you their current assessments, their most recent assessments, top needs that were identified. And then not only that, but you're able to click multiple boxes for communities. It'll be just below this map. So you can kind of pull all of them together and you can see the top concerns for all the different communities and kind of compare the two. And it really provides an opportunity to reach out to other communities that may have some of the same concerns and work through those. They may have unique ways of addressing those, or maybe together the two communities are able to work out a unique way. Or just gather ideas to come up with something else. But it's a great resource to be able to use, particularly for this. I encourage you just to take a look on those. There are social determinants of health. So it's not just healthcare that determines the health of a community. It's social determinants of health. I want to point out that there are a few different models that depict this. So healthcare, such as insurance coverage and access to care, contributes to about 20% of your health outcomes. Physical environment, so your transportation or weather or your neighborhood, that's about roughly 10% to your health outcomes. Social and economic factors, education, marital status. That leads to roughly 40% of healthcare outcomes. And health behaviors encompasses the remaining 30%. That includes eating habits, substance use, hygiene, smoking, things of that sort. Like I said previously, there are a couple of different models. There are any number of different models that people use, whether it be the graphs or the numbers. The numbers might vary slightly, but for overall purposes, this is you're going to find about generally the same numbers with just slight variations. This is kind of another slide that goes over, give you some more examples of those topics of the social determinants. So we're going to look at secondary data first. This is information that other sources, generally national groups, have pulled together. The Robert Wood Johnson Foundation out of the Wisconsin Population Health Institute creates the county health rankings on an annual basis, and that's what we're using here. These illustrate the community health needs and provide guidance for actions to improve health. So the counties are compared to state rates and the top 10% of U.S. counties in various topics, ranging from individual health behaviors to quality of health care. And there's a link right down here that you could check out that brings you there. Very good information to go over for your community and to keep in mind. So in the list that we gave you, we have a little handout that you should have in your email. You'll notice that the measures and outcomes noted with a red circle means that they are worse than the state average, and measures and outcomes noted with a blue square means they are not meeting the top 10% of U.S. counties. Disregard the red check mark and blue check mark. We have changed the designs, and just a little bit behind on this PowerPoint. So to give you a summary of that data, McIntosh County is meeting or exceeding the state average in quite a few topics: poor for health, poor physical and mental health days in the past 30 days, adult smoking, adult obesity, top 10% nationally, and also in poor physical and mental health days and adult smoking, air pollution, social associations, food environment index. So doing pretty well. Good job. McIntosh County not meeting the state average. There's a few on each list here. I'm not going to go over all of them, but feel free, of course, to pause the video and take a look at these. But these are also available in that link I showed you in the county health rankings. So low birth weight, physical inactivity, access to exercise opportunities, and you'll see some of these come up as concerns throughout the rest of the survey. Not meeting the top 10% nationally, premature deaths, percent of poor fair health, poor physical health days, low birth weight. Again, there's a few here to go over. So take note of those. As far as the children's data, rate of uninsured children is a little bit over 8.5% higher than the state average. Rate of uninsured children below 200% poverty level, higher than that, 11.4% higher than the state average. Medicaid recipients is just over 4% higher than the state. Rate of children enrolled in Healthy Steps, not much different than the state average, 2.2% higher. And McIntosh County has 5.6% less child care capacity than the state average. And again, that I want to point out that last one right there, you might see those coming around here throughout the rest of the presentation. So these are things to take note of. If they're kind of producing a theme throughout the survey, and you'll notice that. So getting into the survey, some of the demographic questions, we had a total of 156 total responses, 16 paper surveys and 140 online coming back to us. Only a few people using the QR code, but we're getting there. Throughout these assessments, you'll notice, if you read anybody else's report, that we receive an overwhelming majority responses from female respondents as opposed to male respondents. That's just what happens. You'll notice that in almost every assessment we've done, that's how it's turned out. Age, 75 years or older, only 5%. A combined 41% were between the ages of 55 and 74 years, which is pretty common for these assessments. And then you have a 34% ranging from 35 to 54 years. And then kind of a small number for 20 to 30, 25 to 34 years. You know, sometimes it's hard. It's difficult when you're a young adult to really get out there and get some of those. And nothing 18 to 24 years, and we do not survey anybody less than 18 years old. Health insurance, a large number of people get their insurance through their employer, and that could be somebody getting it through their spouse's employer as well. Self-purchase insurance, quite a big drop off there into self-purchase insurance, and then the Medicare, and then again another pretty big drop off that goes down the line. 135 total people answered this question, and out of 136 people, again, you have a bachelor's degree with most people, 33%, 11%. All in all, this shows you that so 55% of the respondents had some sort of college degree, and then you had 19% of that just had some college or a technical degree, and then 16% with high school, or with high school or GED. And of course, only one individual answered that less than high school. Employment, heavily on the full-time, 56%, great. Retired, 14%, so right there, that takes you to 70%. Part-time, 12%. Homemaker, 5%. And unemployed, just 1%. Nobody with multiple jobs, though. They might be too busy to get out and get the survey. Key informant interviews. So we like to start off kind of asking people the best things about the community. We like to get really going on a positive note. And again, with other rural areas, I don't want to say that McIntosh County, Wishek area isn't unique. But what's great about these rural areas is that you see some of the same responses, and they're very positive responses. Groups come together to support community needs. Very close-knit. There's simplicity in life. Groups have been able to make the best out of tragedies. Diversity in business, that's great for smaller communities. Lots of resources. The community generally feels, people in the community feel like there are a lot of resources, so you don't necessarily need to go out into a larger town to get what you need. Having a local hospital and clinic, fantastic. People are continuously volunteering to help one another. And I think the last point on here really kind of sums it up. We all work together as a family, and you know, talking about themes when you go over the best things about communities, and not just for your community, but you see a lot of answers that people support one another. You know, they're close. They work well with one another. It's safe. So back to the survey, we also like to start that off with what are the best things about your community. So yeah, 144 people respond to this. And right there you can see people are friendly, helpful, and supportive. People are involved in their community, and people feel connected to the others that live there. And there's a little bit of a drop off after that, but still some good answers. I mean, nothing in the single digits until you get to the other, which, you know, just a couple people answered on those. Quality of life, again, family friendly, good place to raise kids, 83%. Safe place to live, little to no crime, closeness to work and activities, informal and simple. We saw that in there, the simplicity in life. Job opportunities a little low, and pay attention to that, because that's going to come up again throughout this presentation. Services and resources, healthcare. People are glad to have the healthcare that they have in the community. Active faith community, out and about and involved. And quality school systems, that's really good. Access to healthy food, fantastic. Public transit, get a little bit farther down. Public transportation is something that has been an issue for some time in a lot of rural areas. And opportunities for advanced education will be a little difficult, depending on your proximity to something that offers advanced education. Community activities, recreational sports and activities, and local events and festivals right at the top. People are generally enjoying what's going on in the area. Activities for family and youth, and it's high, and year-round access to fitness opportunities isn't exactly low, but those are a couple things to keep in mind while we go through the rest of this presentation as well. There are going to be things here that I'm going to point out that are going to be, again, themes throughout the surveys, throughout the interviews, and you're going to see it throughout this video. Community engagement and collaboration. We ask survey takers and the key informants to to give us your, or excuse me, just the key informants, we asked them to kind of rate the collaboration that these entities have within the community. And this isn't based on their services. This is more based on, do they work well with others? Do they have good community engagement? You know, are they out there? Do you see them? Are you aware of them? Just, are they taking part in the community? This again, this doesn't have to do with their services. So hospital right at the top, 4.75 out of 5, fantastic. Long-term care, 4.5, again, right at the top. Schools, 4.25. 4.25, emergency services, business and industry, pharmacy, faith-based, all in 4. I mean, it's over half of these, over 50% of these listed that are in the 4s, and that's great. Other local health providers, dentists, chiropractors, things like that, 3.25, still very good. Public health, 3.0. And then it starts dropping a little bit low here. So some things to take note of. Human services agencies and social service agencies generally are, again, county-based. So it's going to be a little bit more difficult to kind of see them in some settings. So those do get kind of the short end of the stick. But of course, it's not reflective of their services. So getting into the concerns from the survey, I'll start out with the key informant interviews, actually. These are identified as the top concerns throughout the key informant interviews. So not enough jobs at livable wages, crime and safety, not enough affordable housing, attracting young families and having enough daycare services. Crime and safety, kind of, I would say, almost sort of an outlier in this, whereas the other 3 or other 4 are very linked. If you don't have jobs, if you know, it's going to be difficult to afford housing with a job with livable wages. It's going to be difficult to attract families without those, and without having enough daycare service, it's going to be difficult to attract young families. Starting up a family, and if you have both parents working, it's going to be difficult without having those daycare services. Availability, delivery of health services concerns, mental health services, up and coming over the past few years for rural communities, ability to retain primary care providers and nurses, availability of dental care, cost of health insurance, and emergency services. I want to stress that you might see emergency services come up a couple of times here. Everybody that was interviewed, or at least most of everybody that was interviewed that mentioned emergency services, it was more a problem with staffing. Everybody seemed to agree that the personnel do a great job with what they can. There's just not quite enough to go around to all the communities. So that was brought up a couple of times. Adult population health concerns, substance abuse right at the top, drug and alcohol, depression, anxiety, stress, and suicide. Again, these are things that can be linked to one another. Some people turn to substance abuse because of depression and anxiety. Some people develop depression and anxiety because of substance abuse. Some people turn to substances out of stress, and sometimes these things, depression and anxiety, can lead to suicide. There's a lot of correlation between these concerns. Drug use and abuse for youth population and alcohol or substance abuse for youth population also heavily on there. Smoking and tobacco use, exposure to secondhand smoke, vaping, very hot topics right now for the community. Availability of resources to help elderly stay in their homes, availability of home health, cost of long-term nursing home care, depression, anxiety, and not getting enough exercise, physical activity. For senior population health concerns. If you remember earlier, there was a topic that the long-term and nursing home care was very good in the community. Here it's just pointed out that the cost is a little high, a little too much for people. So getting back to the survey, the prior topics were from the key informant interviews, and now we're moving on to the survey results. 137 people, right at the top right here, heavily outweighing some of the others, attracting and retaining young families, not enough jobs with livable wages. But you'll see that the top 4 are all linked together. Again, like we went over with the key informant concerns. Changing the population size is an issue. not enough jobs. It's difficult to attract young families with jobs with low wages or lack of professional jobs, and lack of child daycare services. Concerns about the availability and delivery of health services. Again, right at the top, ability to retain healthcare professionals. It kind of goes almost hand in hand with attracting and retaining young families. There are certain things that people want to see in their community, and if those aren't available, they might be willing to pass on things. Availability of dental care. It takes certain things to get people to come into the community, and dentists. The cost of health insurance, always kind of a hot topic, and availability of mental health services. And you'll see that again throughout this. That's one of those that you will see arise a lot throughout the surveys, throughout the interviews, and throughout multiple communities in North Dakota. Youth population for this survey, 130 total respondents here, and substance abuse, top 2, drug use and alcohol abuse. Depression and anxiety also weighs heavily in the community as far as youth is concerned, and smoking and tobacco use or vaping. And I'll point out here, not enough activities for youth and children, and that's something that we went to earlier that was kind of pointed out. It was a little bit low on some of the things to do in the community. It's pointed out here, not just through the activities, but fitness centers and obesity sometimes will be on here. Obesity's hanging out here just a little bit above the middle. Adult population, depression and anxiety right at the top. Drug use followed by substance abuse, stress, and again, we see not getting enough exercise, physical activity, cancer, and there's obesity a little bit higher on here than it is youth. Diabetes, which was also mentioned in services later on that we'll get to. Senior population concerns, cost of long-term nursing home care. You have the top 3 that stand out definitely: availability of home health and availability of resources for elderly to stay in their homes. And then depression and anxiety is the 4th, and these were all listed in the key informant interview. So there's a cohesiveness among these answers. You're starting to see the picture of the community's health concerns starts to become very clear as you see some of the same topics being brought up. Barriers to receiving care, where we ask respondents to give us what they perceive are obstacles for people receiving care. It can be self-imposed, and that can also be physical and mental barriers that just kind of prohibit people from receiving care, whether through their own choice or not. Not able to see the same provider over time. And you can kind of say that plays in hand with the ability to retain healthcare professionals. If there's going to be a high turnover, you're not going to be able to see your same people. Not affordable. Again, no insurance or limited insurance. Not affordable. We saw cost of health insurance prior to this rise up as an issue, and that's going to be something again that you will see. Not enough evening or weekend hours. You can see just a little bit down here, not able to get appointment or limited hours, kind of almost goes hand in hand there. We're not able to get those appointments. Not enough specialists, again, plays into not able to bring, with the inability to bring healthcare professionals in. All right, sources of trusted health information. So where do people go to, who do people trust to give them their health information? And thank goodness we have 81% going to primary care provider. I'm sure if you ask any healthcare professional, they would say that going to another healthcare professional is the best way to get your health information. Right here, primary care providers and other healthcare professionals are the top 2. Web searches, while helpful, of course, I'm sure that nobody wants to see it as the top. You probably want to go straight to the best source, which should be a healthcare professional. So it's good to see that a little bit lower, word of mouth a little bit lower, and public health professional, I think just due to the visibility, public health sometimes tends to get stretched a little thin. So that might be a good explanation why it's a little low. Healthcare services to add locally, we asked on the survey and the key informants what they would like to see in the community. Mental health, number 1. And like I said before, it's for the past few years, it's been up and coming, and it's definitely taken on a spotlight. I would say in the past few years as being recognized Not to say that its mark in the community wasn't felt prior to this, and for years and years prior. It's just starting to become more well-known, and people are becoming better educated about it and able to identify it as mental health issues, and kind of leave the stigma behind. Dental, again, bringing people in, but that again, that's something that is kind of sticks with rural communities in requesting dental services along with vision services traditionally. Exercise equipment, there you have where earlier the access to exercise opportunities for both adult and youth was on the list for concerns. Were identified quite high. Walk-in clinic, people, it kind of goes with the extra hours or people want to get in. Substance abuse treatment services. Home health was identified earlier. Pediatrics, massage therapy. So there's a good list here. I think people were pretty focused on that list as well. That's why we don't see a whole lot more. Generally, some of these get kind of scattered all over the place with people requesting, and a lot of people were on the same page with this. So the biggest challenges facing the community during the survey, we asked a question: what is the biggest challenge? And it kind of became apparent that lack of business and economic development and substance abuse overall were the main responses. Lack of business, again, kind of linked with the attracting and retaining young families, bringing in healthcare professionals. There are just certain amenities that people want around before they come to a community, before they commit to living in a community, and people in the community have been able to identify that. And substance abuse, again, something that we've gone over plenty of times throughout the key informants and the surveys. Some of the other challenges you're going to see, and these were, excuse me, I keep clicking past the slide. This was an open-ended question, but you're going to see some similar wording as the concerns earlier. So attracting and retaining healthcare staff, lack of jobs at livable wages, the expensive cost of living, depression, population declining, households not taking care of their property. That is something that more than a couple people brought up. That is generally cleanliness of property, people not taking care of cosmetics of their property. So now we're going to get to go over the needs that emerge from the data. So as I said earlier, some of these issues become thematic. You start to see them throughout the informed interviews and the surveys, and just in general discussion with community members. And this is why it's so nice to be able to come out. And unfortunately, we weren't able to get that at this time. But yeah, so these are the needs that are going to need to be prioritized. So community and environmental health concerns, and again, all four kind of have something in common there. They're kind of a correlation between them: attracting and retaining young families, and the jobs with good wages, population size decreasing, and having enough daycare services. Availability of health service concerns, again, you're seeing some of the same things: ability to retain primary care providers, dental services, cost of health insurance, and availability of mental health services. Youth population health concerns, about the same as they were before, as the key informant identified in the survey. So substance abuse, depression, and smoking and tobacco use and vaping. Adult population health concerns, about along the same lines. Depression just gets bumped up to the #1 spot here. And then followed by substance abuse and stress. And then the senior population health concerns, pretty much identical to the key informant, what the key informants identified. Cost of long-term nursing home care, availability of home health, availability of resources to help elderly stay in their homes, and depression and anxiety. So what do we do now? We have the top concerns, and now we're going to give you a link that should be sent along with this presentation to a Qualtrics survey that we'd like you to select. It'll give you all of the top concerns that we listed for the different age groups all in one thing. We'd like you to select your top 4 out of all of those. And we'd like you to have that done by June 23rd, so that's next week. And then we're going to analyze those results, and we'll make another survey. And this time it'll just be asking you to select your #1 issue out of all the respondents that gave us their top 4 from the previous Qualtrics survey. We just want you to pick one, and then we can kind of get the top prioritized issues out of that. The deadline to complete that will be on by noon on June 30th, 2020, and you will also receive a link for that. Of course, you can always get that done a little earlier. But yeah, so I want to thank you for taking part in this once again. I think I speak for most of the center and who is involved in these assessments when I say that one of the most enjoyable parts of our job is coming out to the community and being able to present you with this and listen to what you're saying and really get involved and help guide the kind of implementation, the strategy for what's going to be done or how we're going to get to these concerns. So I have been Sean Larson for your presentation. I have my phone number right there and my email is available to you. We are working remotely. I do come into the office still semi-frequently. So if you do need to call the number, I will be able to get back to you in a timely manner. Email might be the best way to contact me now. It's right there. And if you have any questions, concerns about the process, feel free to reach out to us or the center right there, and somebody will also get back to you. So with that, you have all the information before you. You should have the link for the next part of the survey for the to whittle down to your top concerns. I urge you to get that done as soon as possible, and we'll close it on the 23rd, and then we'll get you that new link so we can identify the top needs. Again, thank you so much for taking part in this, and have a great day.